Dear Neurology aspirants, today we will discuss the mechanism of action, clinical uses, side effects, contraindications, doses and controversy about betahistine. Before we get started, let us have some pre-test assessments. What is the primary use of betahistine? A. Allergic rhinitis. B. Otitis media. C. Headache. D. Vertigo. How does betahistine act to reduce vertigo symptoms? A. It increases the intracranial pressure. B. It reduces the inflammation in the internal ear. C. It has bactericidal effect on internal ear infections. D. It affects the blood vessel permeability in the internal ear. Current evidence supports the use of betahistine for treating which condition? A. Angle closure glaucoma. B. Meniere's disease. C. Common colds. D. Headache. Before proceeding further, please read the disclaimer carefully. This channel is for the education of medical professionals only. Every effort has been taken to provide the most up-to-date and accurate information possible. However, medical information is constantly evolving. Please consult and verify details with your textbook for the latest guidance. This channel cannot be held responsible for any harm caused by your use of the information provided in this video. The information, including text, graphics, images, and other educational materials are not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor for any medical concerns. By accessing this channel, you agree to our terms of use, including the cookie and privacy policies. Let us discuss a case. Please take a moment to read this interesting vignette. You can pause the video now. A 42-year-old female woke up in the morning with a feeling of fullness and ringing sensation in her right ear. Later on, she developed vertigo. She tried to sit up, but the movement worsened the dizziness. She had similar episodes of vertigo in the past, lasting from 20 minutes to hours. She advised relevant investigations. The doctor prescribed her betahistine 16 milligrams thrice daily for 5 days and asked to follow up with investigations. In this case, the patient had recurrent vertigo, ear fullness, and tinnitus, which suggest diagnosis of Meniere's disease. Vertigo in Meniere's disease may persist for 20 minutes to 24 hours. Betahistine is useful to prevent vertigo in Meniere's disease. Now, two questions come into our mind. What is vertigo? And what is the role of betahistine in vertigo of Meniere's disease? Vertigo is an illusory sensation of motion of either the self or the surroundings in the absence of true motion. Remember, vertigo is a symptom, not a diagnosis. Dear aspirants, betahistine is a histamine analog. It has the property of histamine. You might be knowing that histamine is produced by basophils and mast cells. Histamine causes vasodilation and increases the permeability of the capillaries. We should have a basic idea about histamine receptors to understand the mechanism of action of betahistine. H1 receptors are situated on the postsynaptic membrane. When histamine stimulates H1 receptor, it causes dilation of small blood vessels and increases the capillary permeability. H3 receptors are present on the presynaptic membrane. They act as autoreceptors. They control histamine turnover by feedback inhibition of histamine synthesis and release. Stimulation of H3 receptor by histamine causes inhibition of histamine release in the synaptic clefts. I am trying to make it more clear. See, when histamine reaches the presynaptic terminal, it is released into the synaptic cleft through exocytosis. On the postsynaptic membrane, it stimulates the H1 receptor. H1 receptor causes dilation of small blood vessels and increases the capillary permeability. H3 receptor present on presynaptic terminal. It is an autoreceptor. When histamine stimulates the H3 receptor, it causes inhibition of histamine release in the synaptic cleft, so that it acts as feedback inhibition of histamine synthesis and release. Any agent which antagonizes the action of H3 receptor will disinhibit the release of histamine in synaptic cleft. So, H3 receptor antagonists will increase the histamine release and eventually there will be more histamine available to stimulate H1 receptor, which produces small vessel dilation and increases capillary permeability. Now, it will be easy to understand the mechanism of action of betahistine. As its name suggests, it is related to histamine. It is a histamine analog. It has both the property of agonist and antagonist. It is weak agonist at H1 receptor but strong antagonist at H3 receptor. Betahistine acts as agonist at H1 receptor which causes vasodilation of the precapillary sphincter of stria vascularis of the internal ear. This vasodilation leads to increased vascular permeability and reduces the pressure of endolymph. Reduced endolymphatic pressure relieves the symptoms of ear fullness and vertigo. Betahistine also shows an antagonist effect on H3 receptor which causes disinhibition of histamine release from the presynaptic membrane. That resulted in increased histamine availability for the action on H1 receptor. It enhances the action of H1 receptor-mediated vasodilatation and increased vascular permeability. Betahistine is primarily used for vertigo of Meniere's disease. However, it also reduces tinnitus. You should be aware of various drug adverse effects of betahistine. The common side effects are: dyspepsia is a common gastrointestinal problem with the use of betahistine. Drowsiness and headache are also common neurological side effects. Some serious side effects are also reported with the use of betahistine, such as palpitations, anaphylaxis, angioedema, Stevens-Johnson syndrome, headache, peptic ulcer disease. If a patient has a previous history of hypersensitivity reaction with betahistine, it should not be used again in that patient. It also should not be given in pheochromocytoma patients. Increased histamine due to betahistine causes hypertensive crisis in the patient of pheochromocytoma due to excessive catecholamine production. These are absolute contraindications for the use of betahistine. History of asthma, peptic ulcer disease, hypertension or pre-existing urticaria rashes or allergic rhinitis are relative contraindications for the use of betahistine. This drug should be given with food. Initial dose is with 8 mg to 16 mg 8 hourly. Maintenance dose should be 24 mg to 48 mg per day in divided doses. It is available in various strength of tablets such as 8 mg, 16 mg, 24 mg, 48 mg. It has approximately 100% oral bioavailability. It is metabolized by liver. The blood level of betahistine may be increased by monoamine oxidase inhibitors such as antiparkinson drugs like selegiline and safinamide. Betahistine was first approved in 1970 for the treatment of vertigo in Meniere's disease. Most trials suggest reduction in vertigo and to a lesser extent tinnitus. Cochrane Library Review showed insufficient evidence of any beneficial effect of betahistine on symptoms. This controversy led to the discontinuation of betahistine from the United States. However, it is approved in Europe and the United Kingdom. Some reviewers suggest that discrepancy could be because of bias in methodology of trials. So, betahistine is licensed for treatment of Meniere's disease in Europe and the United Kingdom but not in the United States. Till now, I hope you understand the mechanism of action, clinical uses, side effects, contraindications, doses and controversy about approval of drug in the United Kingdom and United States. Now time starts for the objective questions. Please read these questions carefully and answer them. You can pause the video whenever you need to read the questions. I will try to explain the answer. What is the mechanism of action of betahistine? A. H1 receptor antagonist. B. H3 receptor agonist. C. H1 receptor agonist and H3 receptor antagonist. D. H1 receptor antagonist and H3 receptor agonist. Betahistine is a weak H1 receptor agonist and strong H3 receptor antagonist. Activation of H1 receptor causes vasodilation and increased permeability of vessels of the internal ear, which decreases the internal pressure of endolymph. So, the answer is option C, H1 receptor agonist and H3 receptor antagonist. Betahistine can be useful in the following condition. A. Vertigo. B. Tinnitus. C. Impaired hearing. D. All of the above. Betahistine is approved for vertigo of Meniere's disease. However, off-label, it is also given in tinnitus. It is not useful in hearing impairment. Though both options vertigo and tinnitus are correct, the most appropriate answer is vertigo. So, the answer is option A, vertigo. Which is true about betahistine? A. It is safe in pregnancy. B. It is safe during breastfeeding. C. It should not be given with selegiline. D. All of the above. Betahistine is not recommended during pregnancy because there is not much information on how it might affect baby. Betahistine is assigned to the category B in FDA risk categories. Also, there is less information about fetal risk during breastfeeding. It is better to avoid betahistine during pregnancy and breastfeeding. Monoamine oxidase is involved in the breakdown of histamine. If monoamine oxidase is inhibited, it can lead to the accumulation of histamine. Therefore, monoamine oxidase inhibitors such as selegiline and safinamide may increase the action of betahistine. So, please avoid these medications due to known drug interactions. Remember, selegiline and safinamide both are antiparkinsonian drugs. So, the answer is option C. It should not be given with selegiline. Which is false about betahistine? A. It should not be given in peptic ulcer disease. B. It is contraindicated in pheochromocytoma. C. It is not available in United Kingdom. D. It is not available in United States. Betahistine is contraindicated in peptic ulcer disease and pheochromocytoma. Betahistine was first approved in 1970 for the treatment of vertigo in Meniere's disease. However, Cochrane Library Review showed insufficient evidence of any beneficial effect of betahistine on symptoms. That was the reason the United States removed the license for the sale of betahistine. But in Europe and the United Kingdom it is licensed for sale. So, the answer is option C is not available in United Kingdom. Hope, till now, you must be knowing the answers for the pre-assessment test. Thank you for watching this video. See you in the next video, till then bye bye.